Dr. Bourke is a chiropractor, but also the CEO of Munchee.
It's a chewing device and it's shaped a little bit like a mouth guard, but it's flexible and it's got little prongs on it that massage your gums and teeth. It's an oral motor exerciser. And my father was the developer of this. He was a really forward-thinking dentist. It was originally developed as an oral hygiene and periodontal condition. He started using the Munchee as a chewing device for general facial function, and he started to see growth when he was using that device. You get lots of benefit by chewing.
Chewing can really positively impact the occlusion and the airway and help prevent a lot of these problems that we're seeing in our older kids and adults.
The reality is we just don't chew like we used to. A bone will grow according to the forces placed upon it. And if we do not chew a lot of hard foods and tough foods that require a lot of effort, then we won't get that optimal jaw growth. I'm noticing bites changing. And this is something that will happen when we improve the balance of the forces in the facial muscles and jaws relationships. Chewing is a natural function, a functional movement, and it's a milestone movement. It's something we have to do as humans to establish the strength for feeding and speech. It's working the jaw stabilization muscle, jaw grading, and the more subtle muscles that are controlling the nuance of the chewing function. The tongue has to lift up to the palate to swallow. When you've got a munchie in your mouth, you have to nasal breathe and you have to use the back part of the tongue and the pharyngeal walls, or the walls of the throat, to swallow when it's in there. The BD Munchee is for babies from about 5 months of age. It's all about that neurosensory information back to the brain. We're seeing a lot of overuse of pacifiers. That's one of the biggest things that will interfere with the way the chewing responses should be developing. Chewing a munchie, getting that saliva production, getting that tongue up, especially before bed, getting that upper airway activated so that it's got better likelihood of staying open at night. Any childhood therapy program is deficient pretty much in their maxillary growth when we've got mouth breathing, incorrect swallow, all that deficiency. We start to see things more like anxiety, issues in concentration in class, and some of that learning and behavioural stuff. A lot of other people are using it for things like TMJ. Such an important part of TMJ is the tongue function. When they're working well, it provides like a sling for the TMJ. We were utilising that to wind down the sympathetic nervous system response. Gives your jaw a rest posture, a rest place. It's a good myofunctional tool to use in conjunction with Invisalign. Expanders, it's a fantastic tool for mouth breathing. Chewing, swallowing, breathing is still profoundly beneficial for all the different ages for different reasons. Once you know how to use it, that's when the profound change happens.